thanks everyone. We'll move on to the CCSA Educational Session, tackling violence, harassment, and responsive behaviors in continuing care with evidence-based tools and innovative training. This is where you're going to get some data on what the trends are have been in our industry sectors. Just give me a second on that. Joining us today are two individuals from our team, Amy Fenton, who's the Director of Partnerships and Innovation, and James Harris, who's our newest occupational health and safety consultant with the CCSA. Unfortunately, Marjorie Balingit, who is our innovation and planning coordinator, she was supposed to present today, but she had a personal medical emergency and she wasn't able to attend today. But fittingly, Amy was with the CCSA back in 2025 when we developed our first set of tools for violence and harassment in our industry sectors. And so she came back to CCSA a couple of years ago and is able to help present today. I'm going to have to get her speaker's notes up. So or if we can get another laptop. Sorry, everyone online, just give us a second. Changes. You can't do it on there? Yeah, well, just give me one second. Which side just go back. Just go back. Yeah. Yeah. Just at the presenter there. Okay. So sorry, bear with us for one moment. I'll hand it off to Amy and James just to introduce themselves while they're getting the speaker's notes up and running.
I need the speaker's note. James is a little bit more prepared with his printed off. So while I'm waiting just for my laptop to boot up, so as Dana said, I'm Amy Fenton, the Director of Partnerships and Innovation. So I oversee the core program as well as the innovation side of things, helping with the LMS and other research that we are doing.
Just remembered how to do this.
I'm glad
there you go.
Okay, awesome. So as Dana mentioned, I did previously work with the CCSA from 2012 to 2017, and then I've been back for about 2 years now. So yeah, I've been working with, created the initial violence and harassment program that we created back then, and excited to be part of the new programs that we're running and helping to serve you guys going forward when it comes to violence, harassment, and responsive behaviors. And I will hand it over to James.
Thanks, Amy. Hello, everyone. I'm James. I'm new. So I have been doing health and safety for a little over 20 years now in a number of different industries, and then the ACSA, MVHRB, a few others, oil and gas. My first experience in joining healthcare was joining in the middle of a pandemic. So that was one of the most adventurous choices I ever made. Going, oh my God, what did I do? But I loved every minute of it. It was an exciting ride. And I'm happy to say that I've made a new home with the CCSA. And it has been amazing so far. So for this presentation, I will be doing a brief overview of some statistics of violence and harassment, and then Amy will be taking you through some of the steps in building or reviewing your workplace violence and harassment prevention program and how we can help. So let's get started. And do I have to move this one, Dana?
Yeah.
There we go. Okay. So workplace violence and harassment in healthcare is a global issue. And here are some key facts from the World Health Organization, or the WHO for short. So violence and harassment affect all health worker groups and work setting in the health sector. Up to 62% of health workers have experienced workplace violence. Verbal abuse at 58% is the most common form of non-physical violence, followed by threats at 33% and sexual harassment at 12%. So we've known this for years. Assaults, violent acts, harassment remains one of the top 5 types of injuries or accidents reported to WCB in both long-term care and senior supportive living industries. This is a look at lost time claims, lost time injuries for workplace violence, and you can see the number of claims has doubled since 2018.
Is this just in our industry?
Right. Yeah, just in our industry. Yeah, just for long-term care and so SSL.
Yep.
Now, if we look at all claims in the industry comparison, we can see that in continuing care is 3 times the rate. And of course, that's just the ones that are reported, right? Because not everything gets reported. So from 2018 to 2022, 84 healthcare worker years were lost due to workplace violence. And that's the equivalent to 21,067 days. So it's a lot of days. So 1 worker year lost equals 250 days away from work due to injury from workplace violence. And from the top 5 occupations reporting workplace violence, nurse aides and orderlies were the top of the list. Social and community service workers were next, LPNs. Then we have the RNs, registered psych nurses, home support, housekeepers, etc. A lot of days lost. Did you know that 83% of workplace violent incidents involve healthcare patients or residents? That contributes a huge factor to us. And there are negative outcomes from violence and harassment in the workplace that not only affect the individual level, but also the organizational and society as a whole. So looking at a few examples of that, you have from the individual level, the physical injury, stress or fear, low productivity, performance. Moving into your organizational, you have decreased workplace morale, higher turnover or absenteeism. And then you get societal, where there could be a lower interest in healthcare jobs or careers based on this trend. Now, violence is as stated in the Alberta legislation is any threatened, attempted, or actual conduct of a person that causes or is likely to cause physical or psychological injury or harm. And again, many of you probably know this, but again, that key word there is likely, right? It doesn't have to actually be a thing. It has to be likely. Harassment, on the other hand, is a single or repeated incident or objectionable, unwelcome conduct, comment, bullying, or action intended to intimidate, offend, degrade, or humiliate in a particular person or group. It creates an unhealthy work environment, resulting in psychological harm to workers. Both violence and harassment are workplace hazards. So you will find requirements listed in OHS Code Part 27. And as Mal mentioned earlier, the code is under review. Accreditation Standards does have workplace violence prevention as a required organizational practice. So according to the standard, workers should be protected from all sources of violence. And the Registered Nurses Association of Ontario describes 4 classifications of workplace violence. So we have type 1, which is criminal intent. Type 2, client or customer. Type 3, worker to worker. And type 4, personal relationship. CSA Z 1002-12, Health and Safety Hazard Identification, Elimination, and Risk Assessment and Control sets the foundation for adequate risk assessment processes. Assessing the risk of violence is in different settings, and targeting interventions based on identified risks results in positive change and lower worker injury rates, regardless of the intervention. The standard focuses on reducing the risk rather than tolerating risk, which is often what is practiced in various work settings. We want to reduce rather than tolerate. So we have the difference between a hazard versus risk. So risks are tolerated if we just do a hazard assessment. And we should be aware that hazards are different from risks. Therefore, risk assessments are different from hazard assessments. Risk assessment is the process of collecting and analyzing data to identify what in the workplace can cause harm and determine whether additional precautions are needed to control risks and evaluate if the controls reduce the risks. A hazard is the potential for harm, while risk assesses the likelihood and impact of that harm occurring. Remember, hazards create risks, but they are not risks themselves. So let's look at violence and harassment let's look at a violence and harassment prevention program with an OHS lens. It is part of an overall occupational health and safety management system. And we use the PDCA cycle as a model for developing a program or process. In the plan phase, you will see that risk assessment is attached and that risk management and communication are attached to the do phase. So Amy is going to be talking a little bit more about this a little bit later in the tools. So how do we evaluate harm? Well, the risk rating scale provides defined criteria to help determine levels of risk, which can then be plotted on a risk matrix to prioritize hazards. Risk rating involves defining the level of threat and priority arising from exposure to identified hazards in the workplace. Generally, hazards are classified as high, medium, or low, based on the relationship between the following two factors. Probability, so how likely the hazard is to cause injury or illness, and impact, how serious the harm could be should the hazard cause injury or illness. So air travel provides a good example of how probability impact work in a risk rating. So air travel is basically considered one of the safest ways to travel, right? However, when planes crash, it typically results in multiple deaths. So in this case, although the probability rating is low of them actually having an accident, the overall risk level would be higher given the increased severity rating. Another standard that we follow is the psychological health and safety standard, also known as the standard. One of the 13 factors in the psychological health standard is psychological protection from violence, bullying, and harassment. Psychological protection is present in a work environment where worker psychological safety is ensured. Workplace psychological safety is demonstrated when workers feel able to put themselves on the line, ask questions, seek feedback, report mistakes, and propose a new idea without fearing negative consequences to themselves, their job, or their careers. A psychological safe and healthy organization actively promotes emotional well-being among workers while taking all reasonable steps to minimize threats to a worker's mental health. An organization with good psychological protection would be able to state that this organization makes efforts to prevent harm to workers from harassment, bullying, discrimination, violence, or stigma. Based on that standard, the CCSA's Workplace Violence Prevention Program is now under our Psychological Health and Safety Framework under the Programs tab on our website, which recognizes it as one of the factors in the standard. So let's get into those tools that you can use. That, I will pass it on to Amy.
So Marjorie has spent a great deal of time working to adapt the tools from the PSHSA, so we'll be going through some of those for you today. So there are 5 steps to build and review your workplace violence and harassment prevention program, and we will be focusing more on steps 2 and 3, where specific program needs are identified in order to develop effective program components. To ensure an effective and comprehensive program, organizations must design a workplace violence prevention program that goes beyond what is required by legislation and take a 3-pronged approach, cyclical approach that includes prevention, protection, and post-incident response. So the 3 Ps. This model was adapted from mismanagement practices that are widely accepted and used in the occupational health and safety industry. So prevention. So prevention involves strategies taken prior to an incident to deter the onset of workplace violence. And it includes 4 stages: recognizing the risk, assessing existing precautions and prioritizing risk, controlling and communicating the risk, and evaluating and refining the action plan. So RACE. So information gathered in the step 2 completes the first 2 stages of recognizing risks and assessing. And this information should be used to develop the measures and procedures to control the hazards that are identified. So resources for preventing injuries may include client assessment and screening, and there's a CCSA individual client risk assessment, CCSA communicating the risk of workplace violence, a flagging alert program handbook, triggers and care planning, and engaging patients and their families in workplace violence prevention for leaders. Protection focuses on strategies taken during an incident to manage violence and limit harm as much as possible. So activities may include early identification of violent aggressive behaviors, use of coded requests for help, and mobilization of resources. Resources for protecting workers may include policies and procedures for reporting of incidents. And we, as James mentioned, right, the numbers we see are just what's reported. A lot of stuff still isn't reported. We don't know how to report. So creating that reporting policy and procedure, making sure that we have a process for workers to report and an investigation tool. There's the PSHSA, which is the Public Services Health and Safety Association Security and Personal Safety Response System Toolkits, and we'll talk about those in a little bit. Along with other policies and procedures for preventing client or resident aggression, training, preparing for meeting potentially violent residents, work-related travel, working alone. So there's a lot of different resources that we have available that you guys can put into practice. I went too far. I keep pressing the wrong button. Sorry. Wrong button. Post-incident response. So these are strategies that occur after an incident to reduce harm and the long-term negative effects, not only on the victim, but any other individuals involved and the workplace following the incident. So we often know it's not just about the individuals who are directly involved in the incident that are impacted, right? It's the bystanders, it's the co-workers, could be visitors that are in the site as well. They may all be impacted by that incident. Post-incident responses will cover assistance and support for the victims, information sharing and team debrief, which is a big one, debriefing after to make sure that everybody is okay and you're offering resources. Again, reporting procedures and investigations to determine the cause of the incident, right? To try to determine that root cause and what can we do in the future to, it's not always possible to prevent, but again, how can we limit the harm that happens? And then of course we've got our VARB tools and code white and debriefing tools, incident reporting and investigation. So eliminating violence at work is an ongoing challenge, but managing and minimizing the risk is achievable. When hazards are recognized and risks are assessed, the controls can be put in place which will prevent harm to workers. Prevention is grounded in a culture of safety and respect, and is powered by worker participation and involvement and leadership commitment. We want to move away from just complying with legislation and be more proactive and promote best practices. Ultimately, we want to have a system that is driven by culture versus compliance. So whenever possible, the emphasis should be on implementing measures to prevent the workplace violent event, and organizational culture may affect the success of each. So to address workplace violence in your organization, specific hazards that are unique to your communities should be assessed to identify your program needs. And we have adapted the tools and resources to help you. The PSHSA has developed these tools while leading a multi-stakeholder collaboration to address the pervasive and impactful issue of workplace violence in healthcare. The initiative engaged partners from various levels and subsectors of the healthcare industry, and the goal of the project was to deliver a model and toolkit that provides workplaces with a consistent, scalable, and consensus-based approach for achieving sustainable outcomes, and therefore reducing incidents and impact of aggression, violence, and responsive behaviors. So we aim to support our organizations, employers, communities across the continuing care industry. And these tools can also help in hospitals and acute care to help supplement their programs as well. We will focus on the Workplace Violence Risk Assessment Toolkit, as this will help determine needed program components. Once determined, the other VARB toolkits will enhance and strengthen your organization's 3 Ps approach, such as your resident risk assessments, the need for flagging, security, and the personal safety response system. The tools you see in green up here, these are the newer tools or toolkits that have been released since we last talked about the PSHSA toolkit that Marjorie's been working on for well over a year now and has presented on previously. So these 3 are the newest ones. And then the incident reporting and investigation is coming soon. So in the emergency response Code White toolkit, you guys are all very familiar with Code White, sorry. So this toolkit provides resources and information on the effective practices that can be incorporated into an employer's existing policies, control measures, or procedures, or used to create new ones where there are none that currently exist. And they will provide guidance and information on the following: Code White basics, response and sample policies and procedures, roles and responsibilities for individuals when a Code White is called, training, and that post response as well, because that's just as important as what happens after. There are also helpful appendices included that include fillable forms, flowcharts, and sample templates. So a lot of that information is in there ready for you to go to input your information and be able to use it right away. Under work refusals, so the purpose of this toolkit is to provide information and guidance for employers, supervisors, and your joint health and safety committees, or your HSRs, your health and safety representatives, to support the organizational response to work refusals for reasons of workplace violence. The toolkit is also a guide for workers in healthcare to understand their right to refuse unsafe work due to workplace violence, as well as the process. And Miles had mentioned the OHS prevention initiative, so that was something else that Marjorie has been working on. So we have those posters as well that talk about work refusals as another tool that you can have in your facilities up for staff and for employers as well. Transitions, so care transition is a very important part in the continuum of care. Involves moving residents between sectors, locations, and potentially care providers. Moving locations can be a very stressful time, as you all know, and a vulnerable time for not only workers, but also the residents. Fear, uncertainty, and loss of control can quickly lead residents to act violent towards healthcare workers, which may result in physical and/or psychological injuries. Violence during care transition can be prevented by planning proactively to share information and have the right resources in place during that time. So this toolkit provides information on sound practices for planning a course of action, gathering resources, and collaborating with workplace parties and other care organizations to transition residents with a risk of violence. The Workplace Violence Risk Assessment Toolkit contains a detailed hazard and risk assessment designed to help long-term care and community care or designated supported living. It identifies specific hazards related to violence, establishes their risk rating, which is what James was talking about earlier, and also identifies controls and steps to implement actions and action plans. The WVRAT was specifically developed for hospitals and long-term care, but it can be used depending on the complexity of your community organization. And there is still a benefit for SSL or DSL to explore the risk assessment tools. But for those who are more seniors, lodges, or community care, home care, the other risk assessment toolkit, which is assessing violence in the community, may be more applicable to your scale. So we have all of that available for you to have a look to see what pertains best to your situation. The WVRAT groups hazards into 3 categories. So the first one is your physical environment risk assessment, which is completed for the organization as a whole, including common areas. So this might include any areas outside specific units or departments that may contribute to incidents of violence. And individuals who should participate in this type of assessment would include if you have security on site, environmental services, maintenance, your joint health and safety committee members. If you have a workplace violence committee, they can be involved as well. Or if you have another OHS professional or consultant, those are the individuals who might be involved in this type of assessment. Category 2 is department and unit specific work settings. So this is completed for each unit or department. So you're looking at risks related to the work activities, work conditions, and physical characteristics of a work area. So this could also include interview rooms, counseling rooms, activation rooms, or where you may be working alone. And those who should be involved in this type of assessment and in this toolkit when we're looking at departments would be the department or unit managers, supervisors, and the frontline staff as well. The third category is direct care of potentially aggressive or responsive residents, again, which is completed in the units or departments where resident care is provided. Assessment of risks related to the face-to-face care activities provided to and intercommunication with the resident that may contribute to incidents of violence. So here we would want managers of the departments and the frontline staff to be involved in this type of assessment. So this image here, this is just a sample from the risk assessment tool itself, looking at the physical environment. So it's got some information on there already. So it's looking at the hazard itself is arriving and departing from work, and the conditions that are associated with that hazard are on there. In the second column, you would go ahead and assign the risk. And then the third and fourth looks at what are the controls that you might put in place and some possible solutions. So what can we do to ensure or limit the risk of arriving and departing from work and the hazards that are identified? So these are just examples, and there's examples in the toolkits as well. So it's really about seeing what's there, but adapting it to what works best for you and the hazards that you guys have identified. Ideally, your risk assessment should be reviewed and updated at least annually, but may be done more frequently based on the situations that arise in your facilities. And this may include if new leadership comes on board, if there's been changes in equipment, if you've had an incident that's come up, perhaps some changes in staffing, or you have to do more training, you may want to look at your risk assessments and make sure that they still pertain to your operations. If you want to have a look at how these tools were utilized in the acute care setting, you can scan the code on the slide, and we can also get the link put into the chat for you so you can have a look. But there was a final report, which was evaluation of the VARB toolkits in 2019. And an evidence-based evaluation of the 5 VARB toolkits was recently completed to better understand their awareness, use, and effectiveness. The tools are having a positive impact on how healthcare organizations prevent and manage workplace violence, with 89% reporting that the use of the tools improved their processes, programs, and systems. And there's a quote as well that says, a small hospital engaged a PSHSA consultant to help them carry out a workplace violence risk assessment. Over a 4-day period, the consultant and members of the Health and Safety Committee did risk assessments of all hospital departments. They met with managers and staff, they walked through, they took pictures, looked at documentation, looked at the processes that were in place. And as a result, the hospital implemented a brand new communication system and introduced a new system for tracking, staff training, and launched an awareness campaign. So overall, the PSHSA toolkits have greatly and positively impacted organizations that have taken them on. The individual client risk assessment toolkit was developed to help identify behaviors and triggers associated with increased risk of violence so that prevention measures for staff and the resident may be taken. The violence assessment tool provides a snapshot of a resident's immediate risk of violence by identifying behaviors associated with increased risk. And with this insight, healthcare teams can assess the degree of risk, apply control interventions if needed, and improve worker safety while helping to increase quality of care. Following extensive stakeholder consultation, the VAT was adopted from the BROSET violence checklist and the dynamic appraisal of situational aggression instrument for use in multiple care settings. So the VAT can be used in acute care, long-term care, community care, EMS, and should be completed at first contact with the resident. In May of 2022, the Journal of Nursing Administration published a paper by a large US healthcare system that examined the efficacy of patient violence risk assessment tools. And the PSHSA's violence assessment tool was rated the highest of those reviewed. The project team recommended the PSHSA violence assessment tool as the instrument to be used across the care continuum within their healthcare system. So how can we help? We can support you through our workplace violence and harassment prevention program review. The CCSA Psychological Health and Safety Program will also provide continuity and play a vital role in furthering the objectives. We will be piloting this program with 2 to 4 members this year. And this part of the project will enable CCSA members to receive support and guidance to assess the current state of their psychological health and safety program against the CSA standard, or the standard, as James called it. Identify areas of opportunity, including implementation of violence and aggression and responsive behaviors, and develop an action plan. So our goal is to engage with organizational leaders and provide appropriate support and guidance, and empower leaders to address violence, harassment, and responsive behaviors using the evidence-based VARB tools that we've talked about and the Violence and Harassment Prevention Program to drive positive change, which in turn will benefit the industry as a whole. Organizations will be capable of developing and implementing an action plan using the VARB toolkits and continue to improve their violence and aggression and responsive behaviors programs. So as part of this program that we're setting up and piloting this year, there'll be 1 month post-engagement with the individuals after their consultation and discussions. So after 1 month, we'll be looking at the number of action plan items that they've identified based on their the toolkits and the assessments that they've done. After 3 months, we'll be looking at the number of action plan items that were initiated. And then that 6 months post-engagement, the number of action plan items that have been initiated and or completed. So it's not just us coming in, yep, this is this, do this, here's your assessment, yeah, okay, see you later. It's us coming back in after and helping support you through that whole process. And how else can we help? And James is going to let you know.
Okay, so CCSA has a new on-demand course, Managing Workplace Violence, Harassment, and Responsive Behavior. Helps to prevent incidents or injuries caused by violence and acts of aggression and build a more robust safety culture. This real-life scenario-based interactive course discusses how to prevent and mitigate the escalating behaviors of residents, members of the public, and coworkers in and around a care facility. It is a 90-minute class, and we have provided the QR code for the class on the screen. I'll give you all a minute if you want to capture it on your phone.
Okay.
Okay. So also in this engaging and interactive course, you will explore industry-specific real-life scenarios to equip you with the knowledge and skills needed to effectively handle challenging situations. Our innovative approach includes a 360-degree video scenario allowing you to immerse yourself in the dynamic environment. I went next. It did not anywhere else. Yep.
Yes.
Yeah, yeah. Yes.
It's one. Access its own ongoing things, or is it?
Well,
Price per person that's gonna use it?
it's going to be per person because it's individual to each person's LMS. Because it's on our, it's on our LMS, so it's their own separate account for each one to access the actual course. And this is also a clip from us. You'll face branching decisions and animated scenarios to put your de-escalation skills to the test. By the end of this course, you'll be well prepared to navigate and address violence, harassment, and responsive behaviors in a professional manner that prioritizes the safety of yourself and the people around you. So you will get different scenarios. You have to choose different answers as to what to do. Okay, now here's something very exciting. It is brand new. And it's a clip from a screencasting of our brand new Managing Violence, Harassment, and Responsive Behaviors virtual reality. So afterwards, there will be a chance to try out the VR training, I think during the networking. Okay. So we'll go ahead and show you the clip, and then you can kind of see what's happening. Uh-oh, you went too far. Oh.
Sorry.
I'm so glad you made it for your
Yeah.
shift. This storm is crazy. The flooding and fallen trees have caused chaos on the roads. We're going to be short-staffed. This storm is not news till tomorrow. We've been trying to. Is everyone okay?
We need to evacuate now. This area isn't safe.
I need to assess the situation. Please go help Marty. Please go help Marty.
It is a very cool experience to go and do the whole VR thing and look all around and experience all the different things. And there's lots of different decisions that you can choose to try and help Marty. Hey, and that is. Vote on this one. Not on that one.
Oh, there we go.
So thank you, everyone. It was our pleasure to present to you today. Please make sure to scan the QR codes and follow us and stay up to date on CCSA through our social media. Thank you.
Before you guys leave.
Okay, yeah.
Are there any questions from the group, either in person or online, about the information that you presented? And
I wonder if the toolkit, it took into account dealing with residents with dementia. Because that's, you know, a resident that might not be violent today could be violent tomorrow. And then as an organization, we might be waiting for med changes to take impact, waiting for a transfer to a villa. And in the meantime, the staff are exposed to that risk that is hard to manage. So just curious if that was part of that thought process in developing.
Yeah, so the short answer is yes, it did.
Yeah.
So the tools kits were developed in Ontario at a workplace violence table in healthcare, specifically in healthcare. It was led by PSHSA, but it had stakeholders from across the province of Ontario that provided input into the development of the toolkits. So definitely included all types of resident conditions that were considered in the development. Yes. Now you don't have to go to PSHSA's website to get those toolkits. We have purchased a license for the toolkits. We have reviewed them against Alberta legislation to make sure that they were relevant for Alberta. And we have posted them on our website available for all of our members to use. Any other questions? Are there any questions online, Natalia? Okay, thanks, Amy and James.
Yeah, and if you do have questions after, always just reach out to the team. More than happy to help you guys out.
And as mentioned, if you want to try the VR
Yeah.
during the lunch break after the AGM is over, feel free to try the equipment out and try out our first trigger. We're hoping to be able to develop additional triggers as we move along the virtual reality road. But for now, there's just one trigger that's developed.